Dr. Deepthi. I'm a practicing prosthodontist and implant specialist at Smiles for You Dental Care, Sun City, Hyderabad. This video is all about dental myths and facts, and I made this video exclusively for a layman to understand the facts behind these myths. Many people have misconceptions about dental treatments, which are nothing but traditional beliefs without any scientific background, and these are passed from one generation to other through word of mouth. And most of them blindly believe them, follow them, and end up with oral health issues. So today I am going to share the truths about those myths which I commonly hear from my patients in my everyday practice. First and the most common myth is dental extraction and vision loss. Most of them think that there can be vision loss after dental extraction. Whenever I suggest extraction of a badly decayed or hopeless teeth, or in case of gum diseases where the teeth become extremely mobile, or in case of orthodontic extractions, almost 50 to 60% of my patients ask me, will there be any effect on the eyes or any effect on the nerves, any effect on the memory? The answer would be no. It's a complete myth. There is no study or research supporting this. And for your information, the nerves that supply the teeth are completely different from the nerves that supply the eyes. The teeth are supplied by trigeminal nerve, and that's connected to the pons of the brain, and the eyes are supplied by optic nerve, that is the main nerve for vision, and that is located 1.5 mm behind the eyeball, and that is connected to the midbrain. So if you see the origin of the nerves, the cores and their attachment to the brain is different. So whenever doctor suggests you to go for extraction, you can go ahead without thinking about the memory or the vision loss. The second myth is about baby teeth or milk teeth. Most of them think that they are just baby teeth, they are going to fall off anyway. There is no need of any treatment for the baby teeth. But all these are myths. Baby teeth are as important as the adult teeth. They not only help the child in chewing and speaking, but they also hold the space for the permanent teeth and guide them into the oral cavity. If you notice any small cavities or white spots on the baby teeth, you have to get them treated immediately. If you delay, the cavity may progress and may result in the infection, abscess, swollen gums, and sometimes teeth may become mobile, making it difficult for your child to eat and the food intake is affected. And if the baby teeth are lost at an early stage, then the adjacent teeth tend to drift into that space, and the position of the permanent teeth is affected. Permanent teeth comes in an abnormal position, leading to crooked teeth or crowded teeth that may require orthodontic or braces treatment in the future. So baby teeth are very important. Don't neglect them. Good oral health starts with the baby teeth. Third myth is about wisdom teeth. Wisdom teeth are the last set of molars or the third molars that appear at the back of the jaws. They emerge between ages 17 and 25. They are the last teeth to appear in the oral cavity, hence named as wisdom teeth. Not everyone has wisdom teeth. 39% of the population are born without wisdom teeth. Our ancestors needed wisdom teeth. They had broader jaws. The chewing patterns, the type of the food was different. They used to eat raw, uncooked and coarse food, so all the wisdom teeth were functional in them. But during the course of evolution, as the jaw size became small, now there is no enough space for the wisdom teeth, leading to impactions in 85% of the cases. So whether to keep the wisdom teeth or not depends on the position of the wisdom teeth. If the wisdom teeth has shown up completely and if it is in proper alignment, if it is healthy and if it is not causing any damage to the adjacent teeth, and if you are able to maintain your oral hygiene, then you can keep them intact. But if the wisdom teeth is associated with any pain, swelling, infection, and if you are not able to maintain your oral hygiene and if it's affecting the adjacent teeth, then you have to go for extraction. And trust me, you are not going to lose your wisdom if you get them extracted. Fourth myth is about dental scaling or cleaning procedure. Most of them think that dental scaling is a painful procedure and it's going to damage the enamel of the teeth. But all these are myths. Dental scaling is a completely painless procedure. It's a non-invasive procedure and we use specially designed ultrasonic tips which are made up of stainless steel, and these are designed only to remove the external stains or the deposits which are accumulated over the surfaces of the teeth, and these are not going to penetrate the enamel or damage the enamel, which is the strongest structure of the body. Dental scaling improves the teeth and the gum health. So it is advisable to get the scaling done once in 6 months or at least once in a year. It's like an investment for your oral health. oral health, most of them think that oral cavity is a separate entity and it is not connected to the general body health. But there is a strong synergic relationship between your oral health and general body health. Mouth is the gateway to the whole body. It's the entry point for the digestive and respiratory tract. There are millions of bacteria in the mouth, and all these are under control when you maintain oral hygiene. If you neglect your oral hygiene, then the bacteria may multiply, may enter the bloodstream, and may reach other parts of the body and affect them. And there are many diseases which are associated with, which are linked up with gum disease, like heart disease, diabetes, respiratory diseases, rheumatoid arthritis, and osteoporosis. And there is a reciprocal relationship between diabetes and gum disease. In diabetic patients, if the oral health is maintained, then automatically the need for the insulin is reduced. And in the same way, if the diabetes is under control, then the gum disease is improved. And there are many other diseases in the body which are reflected in the mouth, like Crohn's disease, blood related disease, nutritional deficiencies, kidney related disease. All these are indicated in the mouth. So your oral cavity is the indicator for the general health. Don't neglect your oral health. Get your oral health checkup done once in every 6 months or at least once in a year to get an idea about your oral and overall health.